I'm Charles Tator. I'm a professor of neurosurgery at the University of Toronto and the Toronto Western Hospital. I've been a spinal cord injury researcher, both a basic scientist and a clinician scientist for the past 40 years. And I was very pleased to speak about the achievements in the field over the past 25 years. We have achieved many things, both in the clinical management of patients and in basic science, in understanding the injury. For example, we now know about the importance of early triage to an acute unit. And we'd like to see every spinal cord injury patient reach the appropriate unit within 2 hours. We know the importance of that in preventing complications and in maximizing the recovery that each person can make. We know the importance of this in terms of the reduction of the mortality rate, which has just plummeted. The mortality rate 50 years ago was probably about 50%, which is incredible. Now it's down to 5%. Imagine the amazing care that we can provide people in terms of supporting blood pressure, breathing, and in maximizing their potential for recovery by early appropriate treatment. We've seen a major reduction in complications. We've seen improvement in education of the public so that there's very little incidents now of somebody being picked up injudiciously and made worse because the spine wasn't immobilized right from the start. So the public has really been educated. We've seen important clustering of care for both rehabilitation care and for acute care. This regionalization has gone on in Canada and in many other countries to result in improvement. We've seen much greater understanding of how to protect the cord initially. We understand the loss of blood supply and the importance of early treatment, which includes maintenance of blood pressure. We see how the injured spinal cord is very fragile and subject to loss of further tissue unless patients are managed judiciously, for example, in an intensive care unit. And all major cervical injuries, for example, should be managed in an intensive care unit with invasive monitoring. I think we've heard about the importance of collaboration, cooperation, globalization. We're thinking outside the box now. We're thinking of how to bring organizations together, how to bring foundations together with governments and together with industry to make an even greater difference. My generation has certainly moved the needle along, but we're not at the goal yet. We're not at the place where every spinal cord injured patient is going to benefit dramatically from our treatments. We need to discover better treatments. We need to do more basic science research. We need to keep that pipeline of research open by feeding it with new ideas at the basic science level and by examining those ideas at the clinical level. True translational research, the spectrum through that whole pipeline of research. That's what's going to make the big achievements over the next 25 years, especially the getting together of private foundations like the Rick Hansen Institute with governments, with industry. We need that type of global thinking to really make the achievements for the next 25 years. It's very important to draw the parallels between major injury to the spinal cord and major brain injuries. For example, from trauma or from stroke, so that what we find in this field can in fact be translated to other fields. It's very easy to do that at the basic science level and at the clinical science level. For example, the same processes that go on in the injured spinal cord occur also in stroke, also in brain injury. The same complications of urinary tract infections, pneumonia, pressure ulcers that we tackle in the spinal cord injury field are also require dealing with other diseases like brain injury and stroke. And so there are definite connections between the fields. So it's not just the spinal cord injury field that will benefit from any breakthroughs, but also these other fields will also benefit.